Have you ever experienced a persistent cough, runny nose, or sore throat and wondered if it's just a common cold or something more? Stay with us as we uncover the early symptoms and diagnosis of human metapneumovirus, or HMPV, a virus often mistaken for the common cold. Welcome to our channel HIV RNA Test Guide, your trusted source for health information. Today we're diving deep into HMPV, shedding light on its early symptoms, how it's diagnosed, and why awareness is crucial for your health. Understanding HMPV virus. Human Metapneumovirus, or HMPV, is a respiratory virus that typically causes symptoms similar to the common cold. Most people contract HMPV before the age of 5, but it can affect individuals of all ages, especially during the winter and early spring months. What is Human Metapneumovirus, HMPV? Human Metapneumovirus, HMPV, is a respiratory virus that can cause symptoms similar to those of the common cold. Discovered over 20 years ago, HMPV is part of the pneumovirus family, which also includes respiratory syncytial virus, RSV. While most infections are mild, certain groups, like young children, older adults, and those with weakened immune systems, are at higher risk for severe illness. Early symptoms of HMPV. Recognizing the early symptoms of HMPV is essential for timely care. These symptoms often resemble those of a cold and can include cough, runny nose, or nasal congestion, sore throat, fever, shortness of breath. In infants and young children, HMPV can lead to more serious conditions such as bronchiolitis or pneumonia. Adults may experience exacerbated asthma or chronic obstructive pulmonary disease, COPD, symptoms. In more severe cases, individuals may experience wheezing, difficulty breathing, and asthma flare-ups. Young children, older adults, and those with weakened immune systems are at higher risk for severe illness. When to seek medical attention. While most cases of HMPV resolve on their own within a few days, it's essential to recognize when medical attention is necessary. You should see a doctor if you or your child experiences difficulty breathing, severe cough, high fever, persistent wheezing. Transmission and prevention. HMPV spreads through respiratory droplets when an infected person coughs or sneezes. It can also be contracted by touching surfaces contaminated with the virus and then touching your face. To reduce the risk of infection, wash your hands regularly with soap and water. Avoid close contact with individuals showing symptoms. Disinfect frequently touched surfaces. Practice good respiratory hygiene, like covering your mouth and nose when coughing or sneezing. How is HMPV diagnosed? If you or a loved one exhibit symptoms beyond a common cold, especially if there's difficulty breathing or a high fever, it's important to seek medical attention. Healthcare providers can diagnose HMPV through physical examination, assessing symptoms and medical history, laboratory tests, collecting respiratory specimens to detect the virus. Diagnosing HMPV involves several steps. Clinical evaluation. A healthcare provider will assess your symptoms and health history. Swab test. A nasal or throat swab can be taken to test for the virus using methods such as PCR testing. This detects viral RNA in respiratory samples. Rapid antigen tests. These identify the virus quickly in acute cases. Blood tests. Complete blood counts may help evaluate the severity of the infection. Imaging. In severe cases, imaging studies may be used to assess lung involvement. These tests are crucial as HMPV symptoms overlap with other respiratory illnesses, making accurate diagnosis essential for appropriate care. Treatment and care. Currently, there's no specific antiviral treatment for HMPV. Care focuses on relieving symptoms. Staying hydrated. Using over-the-counter medications to reduce fever and alleviate pain. Getting plenty of rest. In severe cases, especially for those with underlying health conditions, hospitalization may be necessary to provide supportive care, such as oxygen therapy. Importance of early detection. Early detection of HMPV can prevent complications, particularly in vulnerable populations. If symptoms persist or worsen, consult a healthcare provider promptly. Early diagnosis not only aids in effective management, but also helps prevent the spread of the virus to others. Differentiating HMPV from other respiratory illnesses. Given the similarity of symptoms, distinguishing HMPV from other respiratory viruses like influenza or COVID-19 can be challenging. This underscores the importance of laboratory testing for accurate diagnosis. If you experience symptoms such as a persistent cough, fever, or difficulty breathing, especially if you are at higher risk for severe illness, seek medical advice for appropriate testing and care. Recent developments and awareness. Recently, there has been a surge in HMPV cases in certain regions, leading to increased awareness about this often overlooked virus. Staying informed and practicing preventive measures can significantly reduce the risk of infection. Understanding the early symptoms and diagnosis of HMPV empowers you to take control of your health. Stay vigilant, practice good hygiene, and don't hesitate to seek medical attention when necessary. For more information, consult reputable sources like the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO. Stay informed, stay safe. Thank you for joining us today. If you found this information helpful, please like, share, and subscribe to our channel for more health insights. And don't forget to hit the bell icon. Stay healthy and take care.